Should I start?
Yes.
Hello and welcome to this special show organized by Akash Institute, where we are going to be talking about how to avoid digital eye strain and how to take care of our eyes when our screen time has increased exponentially over the last few months. जब से लॉकडाउन शुरू हुआ है कोविड-19 पैंडेमिक के चलते हम सब अपने घरों में बंद हैं और विलिंगली या अनविलिंगली हमारा स्क्रीन टाइम काफी ज्यादा बढ़ गया है। हम स्क्रीन के सामने काफी ज्यादा देर तक बैठे रहते हैं, चाहे वो ऑनलाइन क्लासेस हो या वर्क फ्रॉम होम हो। तो इस इंक्रीज स्क्रीन टाइम से हमारी हेल्थ और स्पेशली हमारी आईज, जो हमारी आंखें हैं, उनको क्या असर होने वाला है, इस सब पर बातचीत करने के लिए हमारे साथ है डॉक्टर प्रशांत चौधरी, सीनियर कंसल्टेंट ऑप्थेल्मोलॉजिस्ट at Akash Healthcare Super Specialty Hospital. He has a special interest in cornea and refractive surgery and has vast experience in treating corneal disorders. उन्होंने अपनी undergraduate और postgraduate studies All India Institute of Medical Sciences की है, and he also has a fellowship at the Bascom Palmer Eye Institute, Miami. Thank you so much for joining us, Dr. Chaudhry.
You're welcome. One more qualification. I'm also an Akashian. I did my PMT training from Akash Institute as well.
That's great. Dr. Chaudhry, मेरे कुछ फ्रेंड्स हैं जो कहते हैं कि उनके बच्चे आजकल ना कंप्लेन करते हैं कि रोज सर में दर्द हो रहा है, और उनके बच्चे थोड़े बड़े हैं, बड़ी क्लासेस में हैं, बोर्ड क्लासेस में हैं, और उनकी तो ऑनलाइन क्लासेस काफी होती है, स्कूल की, कोचिंग की। कहते हैं रोज बच्चों को सर में दर्द हो रहा है। क्या ये ज्यादा स्क्रीन टाइम की वजह से होता है? और पिछले कुछ महीनों में आपके एक्सपीरियंस में आपने क्या देखा है? क्या आपके पास ज्यादा पेशेंट्स आ रहे हैं जो आजकल यंगर हैं?
We are seeing this quite a lot now. Screen time बहुत बढ़ गया है, and the purpose of this webinar is to actually educate all of us and make us understand exactly why this is happening, how the screen time is affecting our eyes, and what are the small measures, just very small changes we can do in our the way we do our work and the way we use our screens, such that our eyes stay protected. So I'll just share a presentation. Just go through this presentation. Is the presentation visible?
अभी तो हमें आपकी presentation नहीं दिख रही है। आप you have to share your screen.
Sure. Now it's visible.
Yes, now we can see. Please go ahead.
Yeah. So first of all, very thank you for having me here. And we practice, like ma'am has said, at Akash Healthcare, which is in Dwarka, Delhi. So a very tiny virus which hit us last year has been circulating around the globe. It has made us all wear masks, and which is very important. We should continue wearing it. And along with that, we have taken a deep plunge into digital life. Now, we're using the computers to do everything that we used to do outside previously. We attend our classes on it. We have all our course material on that. A lot of our family members are working from home. We are having meetings on home, like this meeting we have on Zoom and Google Meets. Online shopping is what we are all using because we want to avoid going to the store. We're learning new hobbies. Our children are playing musical instruments, all online. Reading news, banking activities, reading books, and even for entertainment, we're using the internet. So this has vastly increased our screen time. It has been definitely a boon if you compare it with maybe the Spanish flu 100 years back. People were paralyzed then. But because of the computers, we are able to continue our lives at almost the same pace. And many of us, our professions are such that we can continue, even the students, without the need to go to physical classes because we have these digital classes. So online platforms allow us through digital classroom to continue our education. Our family members work from home. E-commerce allows us to, without leaving the home, have access to everything and entertainment. But like Anisha ma'am shared, the result is digital vision syndrome. So digital vision syndrome is a gamut of all the things that happen because of all the devices. This can be a television, it can be a screen of a laptop, desktop, and very importantly, also the mobile phone. So there are two ways in which digital devices affect us. One is because to see a digital device which is close to our eye has to focus more, which we call accommodation, and our eyes need to come together, binocular vision stress. And second is symptoms related to dry eye. I will go much more in detail with this, but this is like two classes of uh, implications which the screen has on our eyes. So first, let us just understand how the eye works. The eye works by focusing the light from the distant object onto the retina. Now, like a DSLR camera, if you have to look at something which is close to you, like a screen or a book, you will need to focus it. So this focusing mechanism is there in the eye, and there's some muscles for focusing. These muscles are the ciliary muscles. And if our eye is focusing for prolonged periods of time, like we're looking at a computer, a screen for a long time, so it is like it has stayed in that focused position, and sometimes it also gets jammed in that position. So excessive focusing of the eye leads to a strain and digital eye strain. Then secondly, blinking. Why is it important to blink? So yes, 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 eyes. So our eyes blink. Uh, just give me a second. Hmm. Vidya? Yes. So when we blink, our eyes get moisturized. And in the process, yeah, you just have to give me 1 second. It's one of the effects of work from home. So when we blink our eyes get moisturized. So what you can see is that every time our eye is opening, the tears actually spread across the eye. And if our eye does not blink for a prolonged period of time, all the water gets evaporated and dry. This causes dry eye syndrome. So this is the second important thing, that we need to blink often. The third basic thing we need to understand is that when we're looking at something far, our eyes are actually straight ahead. When we look at a near object, then the eyes come together. So whenever we are reading a book, to some extent, our eyes are coming together. And if we have weakness in this, it is called convergence insufficiency. So have you ever had any of these symptoms, Anisha ji?
Oh, yes, I have dry eye problem. And in fact, my ophthalmologist has told me that
Yeah.
I have something called blepharitis, where it's just not the, not just the tears, but the tears have some oils from a sebaceous gland in the eyes. And, that prevents the tears from evaporating very quickly. So that oil is there and the oil glands in my eyes are blocked. So I'm having a dry eye problem for which I have to put eye drops very frequently. And of course, massage my eyes after warming them so that some of the oil
The
starts to come out.
glands, yeah, yeah,
Yeah,
yeah. So meibomian gland dysfunction. So
yes.
now that we understand the basic thing about how our eyes work, let us look at the symptoms that we have. So the symptoms of eye strain, headaches, blurred vision are all due to excessive focusing of the eyes. So like we were discussing in a DSLR camera, if
Mhm.
your focusing gets jammed, so you're reading for near, your focusing has gotten jammed, you look far, you cannot defocus immediately. So that causes all of these symptoms of eye strain and headaches. And dry eyes, similar to what your ophthalmologist also told you, that causes irritation, burning of sensation in the eyes, tiredness of the eyes, sensitivity to bright lights, eye discomfort. A lot of people will tell me that, we feel like just closing our eyes and that is so relaxing. And
Mm.
when we keep our eyes open, they start burning and they feel very tired. So those are manifestations of dry
Dry
eye.
eyes.
and pain in the shoulders and neck, that is again related to a very bad posture. Mm. So once we understand this, let us see how common is this problem of digital eye syndrome. So this is all data from before this COVID era. So in people who regularly use devices,
Mm.
see that 75% of them have symptoms of dry digital eye syndrome, especially those who use multiple devices. If there is single device, around 50%, and two or more devices, 75%. So it is a very common problem even before the COVID era.
Mm.
Dryness is also much more in people who use computers than in the other people. Now, with the COVID times and with the lockdown, this is probably much more. It may be nearing somewhere around 80, 90%. And to prove that this is actually due to devices, there are some studies which have made the children away from all screens for 4 weeks. Children who had extremely severe symptoms, and the symptoms were markedly lesser. They were almost okay at the end of 4 weeks. So there is no doubt that screens do have these effects on us, and these are very common. So now the most important part of the slide, what are the things we can do to prevent digital eye syndrome? So the first, and I think everyone must have heard this many times, the most common thing is the 20-20-20 rule. So when we are looking at our screen continuously, after 20 minutes, we need to take a break of at least 20 seconds and look far away, at least 20 feet away. So that means you could look out of a window as far as you can, because the moment we look far away, our eyes do not need to focus anymore, they're relaxed.
Mm.
And we kind of give them a small breather, a small break. We can also take this opportunity to just get up, stretch, walk around, have a glass of water. So this 20-minute rule is very important. Now, people in their breaks also switch to their mobile phones. So that is not a break for the eyes. It may be a break for the mind. But for the eyes to have a break, do not go to Facebook or WhatsApp or to your mobile phone. Take a break by looking at a far distance, and it would do your posture also a world of good if you could stretch and walk around a little bit. So I often give this analogy that, if you have to lift some weights, if you after 20 minutes, this is what will happen. So if
You
you
get
want to lift,
tired.
get tired. And if
Mm.
you think, no, I lifted for 1 hour, by the end of that, your muscles will be sore.
Very sore.
Then after that, when you put it down, then they will stay sore for some time. So
Mm.
if you had taken the break, maybe after 20 minutes, you could hold it, you may get enough relaxation. But once you have spent many hours, day after day, giving the eye a lot of work without rest, then they get sore, and then it takes sometimes days to weeks to recover from it. So it is important that on a day-to-day basis, every 20 minutes, if we just keep our eyes getting that little bit of relaxation, half a minute, then we do not have that condition arise in the first place. The second thing, like we discussed, blinking makes our eyes wet. So we should blink more often. Now, normally we blink enough. We blink 16 times a minute. But when you're staring at a screen, we don't want to miss a letter. We are looking at everything more closely. We stop blinking, and the blinking rate comes down to about 6 times a minute. So this leads to drying of the eye. So we should do conscious blinking. One very good trick you can do for this is that, when you're taking your break, just close your eyes for 2 minutes, open it, 2 seconds, close it again for 2 seconds, give it a gentle squeeze, and then open it. You'll notice that after that, your blinking will also become better. Your meibomian glands will also get expressed, and some of the oil will come out,
Mm.
and your eyes will be feeling much better. So blinking is extremely important. We need to consciously blink. A lot of people write blink on a sticky and put it next to their workstation. So whenever they see that, they remember
Mm.
to blink. So any tricks like that can be helpful to increase your blinking rate. And the ambient lighting is also very important. To be in a dark room with a screen on is to give your eye a lot of strain. There'll be a lot of contrast, a lot
Mm.
of glare. So the room ambient lighting should be sufficient, not too bright that you need, put some curtains if it is too bright. It should be sufficient. And the screen should be far from us. The further the better, at least at an arm's length, it should be away from the eyes.
Mm.
Mobile phones are closer to the eyes. That is why it is much more preferable to use a laptop or a desktop
Mm.
than a mobile phone. The best option, if possible, is of course to have a television, which is nice and far from us.
Mhm.
The position of the screen and the screen brightness, I would like to take this up in more detail. We'll just be taking another slide on that. So, yes, the device, how bright should your screen be? Now, if it is too bright, it causes glare. If it is too dark, it
Mm.
causes strain on the eye. So, a very good way to adjust the brightness of your screen is just take a white paper, have
Mhm.
the lighting as normal, put a white screen, and make them equal. If your screen brightness is equal to that of a white paper in the background, so
Mm.
the room lighting and your screen lighting are equivalent. So the eye does not have the strain of looking at the screen. So matching it with the environment will definitely also make your eyes relax. And very importantly, cut down on essential time. So screen time, generally, if we ask a patient how many hours of screen time do you have, they'll say, well, I have 4 hours of work or 4 hours of class, so that's my screen
Mm.
time. But other than that, what about the games that they play
Social,
on the social media,
social media.
maybe the news that they're reading online, even in the lunchtime, they're looking at something on the phone. So all that is accumulation of the screen time, which should be cut down. We can, this initiative should be taken by parents itself. A lot
Mm.
of parents will complain that my child is on front of the screen the whole time. Go out with him, go for a walk, go to the park, and um, take some hobbies, have some music together, play some board games. So all of these things are better than more screen time during the relaxation. So we need to just minimize the screen time to only what is essential for our studies, for our work. Uh, this is a very common question which everybody asks. You may also have seen these blue cut
Mm.
glasses.
Yes.
So, what is blue light? Is it harmful for our eyes? Should we use blue cut glasses? So, um, light is there all around us. Now,
Mm.
the blue light, we have seen in studies that the blue light from 415 to 455 nanometer, that is the most bluest light, and the ultraviolet light are harmful for the eyes. But there is one part of the blue light, which is a turquoise blue light, which is useful. So these blue cut glasses aim to cut down on the blue violet light, whereas they allow the useful blue light to pass into the eye. Now, the blue light is very important for our body clock. That blue light tells us that it is daytime, we should be activated. Our brain will be more
Mm.
fresh, will be more alert. And towards the night, when it's sunset, our brain is tuned that there will be no blue light, whatever fires there used to be through evolution.
Mm.
That kind of has a calming effect on our brain, and we go into a slumber and we go to sleep. So that is why a lot of blue light, which is in the computers, TVs, cell phones, and tablets, actually are not good for us, especially they disturb the sleep cycle. So we
Mhm.
would say that at least 1 to 2 hours before your bedtime, you should stop using these devices. And if you
Mm.
do use them, you can have the mode where you have night mode. So there'll be less of the blue light coming.
Mm.
Now, should you invest in blue cut glasses? So we know that blue light has a deleterious effect on the retina through the years. That is, decades and decades and decades of blue light exposure can
Mm.
lead to something we call age-related macular degeneration when we are much older. But do they affect digital eye strain? Now, that the jury is still out. Many of the studies have not shown it to be particularly useful in
Mhm.
preventing digital eye strain. So I
Mm.
would say if you anyways require to use glasses, you have been given prescription glass from your doctor, then a blue cut is not a bad idea. In
Mm.
your adulthood, when you're very old, when your teeth are falling off, your eyes will still be in a good condition. But if
Okay.
you do not have a power, then to specifically buy glasses just to block the blue light, that is not proven to be of much use, and it is probably not so much of a factor which will help in it. The other things are much more important, like what we're discussing, the 20-20 rule,
Okay.
blinking,
Looking away.
looking away. Yes. So, one more thing is that if you do have prescription glasses which have been given to you,
Mm.
then you should use them when you're looking at a screen. So, in any case, when you're looking at a screen, there's so much of stress. And if you have a power of the eye and you do not
Mm.
wear the glasses, you're adding to the strain on the eyes.
Mm.
But contact lenses are not such a good idea. Contact lenses induce dryness of the eyes,
Mm.
and to wear it for multiple hours on a screen will only add to the strain. There's some lubricating eye drops, which, like what you're also using, ma'am, which
Mm.
are useful. Preservative free forms of this, like refresh tears, on tears, add tears, genteel. Any preservative free lubricating eye drop can be
Mm.
used for those who have multiple hours of screen
Screen
time.
time.
Like most students at Akash, they
Mm.
have school in the morning, then in the evening as well. So two
Mm.
to three times they could use these drops if they're having any symptoms. One thing that we are seeing nowadays is that all children are wearing glasses. You'll see small
Mm.
children, 4 years, 5 years, wearing glasses. So there is an epidemic of this, and one of the reasons because for this is too much of screen time. Too much of screen time has been shown to
Mm.
increase the risk of wearing glasses. And those who are wearing glasses, their power increases very fast. Fact, one recent study has shown that if you're using glass screens for less than 1 hour per day, then the
Mm.
incidence of myopia is much less than if you're using for more than 3 hours a day.
Yes. Okay.
So this is maybe 3%, and that is like 16%. There's a five-fold increase. And the smaller the children, the more the impact it has of using a screen. If it's a 12 to 13-year-old, then maybe a 22% would go to a 27%. So the younger the children, the more deleterious it is to have multiple hours of screen time. But then there are also things which are very interesting, like the study done even in Delhi itself, the North India
Mm.
myopia study. This showed that more than 5 hours of studying per day or use of computers, video games, especially mobile phones, watching 2 hours per day. These
Mm.
increase the risk for requiring glasses. But there was a protective effect if you were spending more than 2 hours outdoors. Now we know it is Corona
Not
times. You
possible.
should not go outdoors so much. You should wear a mask. So if you
Mm.
have a balcony, if you have a rooftop, you could maybe spend some time there, take your book there, read there, to spend some time there. And if you can go out jogging, like
Mm.
all the students who are in class 11th and 12th, they have so much of studying to do. Just go out 1 hour in the morning when there is sunlight, get some sunlight exposure, do some physical activity, wearing a mask, staying away from other people. You have to
Mm.
follow the precautions.
Rules. Yeah.
With that, if you do this, then the effect of the glass and the screen time can be negated to some extent. So it has a protective effect against this. So children and toddlers also, they should have some
Mm.
time outdoors, but we should ensure that they wear a
All
mask, and
precautions.
yeah, they take all precautions. And sunlight also allows our body to produce vitamin D.
Mm.
Vitamin D is important for our bones, also for our eyes. Dry eyes also been linked to vitamin D deficiency. And to have that half an hour of sunlight exposure every day keeps us our eyes dryness also much less.
Mm.
So the next thing that I was saying, that our eyes need to look close. Some people have weakness of this. It is quite common, especially in people who read a lot and spend a lot of
Mm.
time on the screen. If you ask them to look for close, then their eyes cannot converge so much. So everybody who's using a lot of screen time, if they're having strain, especially if they look, then after some time, the screen appears doubled or shadowing. They should do this pencil push-up exercises. So this pencil push-up exercise is extremely easy. You take a pen,
Mm.
you look at the tip of it, you stretch your hand out, and you slowly bring the pen close to yourself,
Mm.
and you'll notice that the background is becoming double. Keep
Mm.
looking the tip of the pen for 20 seconds and slowly take it out, take it away. And repeat this for about 5 minutes. This will ensure that the muscles of your eye slowly become more and more strong. The process of convergence becomes stronger, and the symptoms of convergence insufficiency become less. So I have a small game for you, Anisha ji. You can see the two cats there.
Yes, I can see.
Yeah, so you could just put a pen or your finger close to the screen and look at the
Mm.
tip of your pen or the
My
finger,
finger, yeah.
and bring it closer to yourself if required. You'll notice that a third cat appears between those two cats, and that third cat has two ears and two whiskers in the tail, the whole thing. I think you'll need to
Yes,
take your finger. Yes?
that is true.
Yeah. So that is also a form of convergence exercise. We call this cat card. So you need to keep looking at the third cat. It'll initially look a bit blurry.
Mhm.
After some time, it'll become sharp and clear.
Mhm.
So do this for 1-2 minutes, multiple times in a day. Now,
Okay.
if you're on the screen the whole time, we can keep this image on the screen itself.
Mm.
Take a
Mhm.
printout and do it with that. So this goes a long way to increase the strength. There's another game I have for you here. So these two, again, we'll put our
Mm.
finger close to the screen, and you will
Mm.
notice that a third circle appears between these two. That third circle has a three-dimensional effect. You will note the blue part, the blue rings are towards you, and the violet rings are away from you.
Yes.
It's like a tunnel that you can see.
Yes. It
This
seems
is
like a magic trick, actually.
magic trick.
You know that
So
your eyes can do magic.
yes, and this magic trick helps your eyes also relax and
Mm.
exercise. So this weakness that they have that is there, that also
Mm.
gets improved with this. Then one more measure that we can do is palming. Palming is a way of relaxing the eyes. We rub our eyes, our hands
Mm.
together vigorously for
Mhm.
15 seconds, put our uh, hands on the cheekbones and rest our fingers like it is in this image. So the
Okay.
warmth of the hands seeps through the eyes and that creates a relaxing effect on the eye. So probably after every class, we could just do some palming,
Mm.
let our eyes relax, stretch around, walk around, drink some water, look far away. Uh,
Mhm.
This would go
Good
a long way
idea.
in helping. We can also do eye rotation exercises once a day. So the eye rotation exercises are basically moving the eyes in all directions. We can move them to the right. You can all do this while watching. Move it to the right, then move your eyes to the left corner. Just follow the instructions. Then look up, hold for 2 seconds. Down, hold 2 seconds. Now look up again, hold 2 seconds. Look down, hold 2 seconds. Look up and right, left and down, up and right, left and down. Now up and left, hold 2 seconds. Right and down, hold 2 seconds. Left and up, hold. Round, round, down and right, hold. And then we can move our eyes in clockwise directions and anti-clockwise directions. So these are very simple exercises that all of us could do once in a day to relax the eyes and release some of the strain due to the screen time. So the next important thing, Anisha ji, is a
Mm.
posture.
Mhm.
A lot of us, when we are studying, we sit on the bed and we study. Like this boy here who's studying, this is called turtling.
Mm.
So he's just bending forward. His neck and lower back is not going to last for adulthood, or at least his old age is going to be very difficult. So we should have a good posture when we sit to study. So ideally, both our legs should be on the ground, planted nicely. Our back should be straight. Our eyes should be looking at a screen which should be 15 degrees below the eye level, and the hand should be at the level of the keyboard. So with this posture, the neck will stay relaxed as well. The chances of you having neck pain, spondylosis, back pain also comes down. The blood circulation to the brain is better. You will have more productivity. You'll be able to have a good back with a good spine, which prevents a lot of other problems. And the eyes stay relaxed with the proper distance and proper angle of the eye screen 15 degrees under the eye level. So it's important to, as far as possible, have a very good posture. In fact, we have had many studies where people lying down, they are having so much more digital eye strain when they lie to one side and read. So now nobody is watching people in the classroom how they're sitting and watching. But if you have a good posture, that will ensure that you stay healthy you for a long time to come. And we are what we eat. Our body is constituted by cells which are made up of only the food that we're eating. Continuously, every part of our body, even the bones are recycled and they're made from whatever we're eating. So if the raw material is not there, the end product cannot be healthy. So for the eye specifically, we recommend that you should have vitamin A, C, lutein, zeaxanthin, zinc, vitamin E. So essentially, if you have enough of spinach, carrots, flax seeds, and walnuts, the eye's requirements are met. So these things should be taken in mind that let us have some walnuts, 2 walnuts every day. Let us have spinach at least 2 to 3 times a week or green leafy vegetables. Let us have carrots. The eye's requirements will be maintained with this. Then this is very important, Anisha ji, for those who have itching in their eyes. So if you have itching, ice packs and some cold compresses go a long way in removing the inflammation of the eyes. So if you have an ice pack, just take a handkerchief, put it around that, and put it in front of the eye for 30 seconds or a minute. Then the other eye, do this once a day. This has the effect of one eye drop in taking care of the allergies and inflammation inside the eye.
Okay.
So just to recapitulate what we have discussed, and this slide, if we can remember even half of this, we'll be much better off. So the 20-20-20 golden rule: proper posture, room lighting and illumination, blinking, blink, close for 2 seconds, open, close 2 seconds, squeeze, open, and continue. Lubricating eye drops, pencil push-up exercises. We can also do the cat card and bucket exercises. Outdoor activities in sunlight, ideal is 2 hours, but do whatever you can. Hydration and cold compresses. And even after following this, after if you have a problem for 2 weeks, then probably you should consult an eye specialist. Maybe you require some glass power which you're not wearing, or your glass power has changed. So that would need to be checked. And maybe some more drops would be required for you. So no talk nowadays is complete without some talk about how to protect ourselves from COVID-19. So very important thing is hand hygiene. See, the infection can go into us only through the mouth, nose, and eyes. These three have receptors through which the virus can bind. Our hands, if they're infected, so long as we don't bring them to our face, cannot take the virus inside. So if we wash our hands properly, then we can make sure that even if we are contaminated, we do not transfer it into our bodies. So touching, using the hand hygiene method is very important. There's a 7-step mechanism of doing it. All of us probably know it. That way we can properly, sanitize our hands and ensure that no viruses uh, stays in the hands. And second thing is that the eyes are not affected by COVID-19. The maximum that happens is an eye flu, which is self-limiting, and it is associated with fever, cough, cold. So even an eye flu can actually be a manifestation of COVID-19 infection, but the eyes are otherwise not affected by COVID-19. So, and I know that our audience is mostly students, aspiring and will definitely become future doctors and engineers of our country. And I would like to wish them all the best. And I feel that if we follow this mantra, which is here, that just enjoy your studies, learn more and more, and strive to, enjoy learning whatever you have and knowing the concept of what is there. The
Hmm.
success will follow itself. So,
Thank you so much, Dr. Chaudhry, for that presentation. We've already started getting a lot of queries, and let's start taking some of those because a lot of students are watching us. Now, we have a question coming in from Aryavant Katpal. He's saying, I am myopic and my screen time is more than 6 hours. Should I wear the blue cut specs, the anti-glare specs?
so the blue cut glasses, like we have discussed, the blue
Hmm.
cut glasses do not cut
Reduce the
digital
strain.
eye strain,
Hmm.
but they may be effective in preventing problems in the eye in future. So it is not a bad idea if you're using glasses anyway. You can use the blue cut glasses, but
Mhm.
do follow the other precautions which we have mentioned, like the 20-20-20 rule, blinking more often, having a good posture, and getting your eye checkup done routinely so that your power does not change. Going outdoors, otherwise the power can go up fast.
All right. Now, we have a question coming from Mansi Sharma. She's saying that I have pain in my eyes and they are watering also. Water is also coming out. What remedy would you suggest?
So for this, I would like to say that if you have pain and watering this just a few days, then probably follow all we have said with more emphasis on cold compresses. The cold compresses morning and evening, do it for a minute. And
Hmm.
if it's still, use some drops. You can use refresh tears eye drops 2 to 3 times a day and follow all of these instructions we have given. If it still persists after 2 weeks, then you need an eye checkup with an ophthalmologist.
All right.
Notice that all the inflammation,
Hmm.
have your redness or itching or inflammation, their
Hmm.
cold compresses are very useful. They really help.
All right. We have another question from Harshal Jani. He says, I have a severe headache once in 3 days. So is this, because of the screen time that I'm getting headaches? Is there a relation here? Because many children, especially those who spend a lot of time in front of the screen, many of them do complain of fatigue and, even headache.
Absolutely. So headache is one of the very common symptoms of digital eye strain. And like I was telling you, if you keep the screens away for 4 weeks, most of these symptoms disappear altogether. So
Mhm.
definitely it is a very common cause of digital eye strain, many common symptom of digital eye strain.
Hmm.
And if you have headache, then you should follow all of these measures. See
Hmm.
it for about 2 weeks. If you find a definite relief, then continue these measures. If it still persists, then an eye checkup or a physician checkup is mandatory.
All right. We have a question from Viva. Viva is asking, what is blue light filtered? Is it effective? I'm guessing she's referring to the blue light glasses.
So our eyes require some amount of blue light to go through. That is a
Mhm.
turquoise blue light. That is
Mhm.
very important for our body clock to function, to
Mhm.
know that it is day, night, even the sleep cycle, the food cycles, becoming hungry. So the blue cut glasses cut down the harmful blue light while allowing the turquoise blue light to pass. These can be useful to prevent you from having cataracts and age-related macular degeneration in the future. That is what has been postulated,
Mhm.
and there is no harm in using them. But digital eye strain does not
Mhm.
necessarily come down with blue cut glasses. So you can use them if there is no harm in them. कुछ
Mhm.
फायदा ही होगा अगर कुछ होगा कोई नुकसान नहीं होगा but they do not work very well for digital eye strain and you should follow the other measures which we have been discussing.
एक और क्वेश्चन आया अथर्व से वो पूछ रहा है हेलो सर कैन वी रिड्यूस मायोपिया आपने हमें वो आई रोटेशन एक्सरसाइज भी दिखाई और वो कैट वाली भी दिखाई और ये पेन पुशअप भी बताया तो अगर हम ये सब करते हैं तो क्या जो हमारे नंबर हैं वो कम हो सकते हैं आइज के अगर हमारा नंबर है माइनस नंबर वो कम हो सकता है क्या
So मायोपिया जो है
हम्म,
कम होने के exercises have not tested, they have not withstood the scientific study testing. So
अच्छा.
all these exercises, in no study has it been proven that they will reduce the power. I know they are done by many Ayurvedic hospitals, by many
हम्म.
natural naturopathy, and they do sometimes claim to have success. But unfortunately, we don't have scientific evidence to prove that they actually work. But what we definitely know that screen time will increase the myopia further. And
अच्छा.
if you are spending some time outdoors in sunlight, sometime outdoors, that has a protective effect against increasing the myopia. So
अच्छा.
whereas they have not been proven to reduce the power, but following these two things can reduce the speed at which the myopia is increasing.
तो अगर बढ़त कम करनी है, अगर जो स्पीड है बढ़त की वो कम करनी है, तो ज्यादा टाइम बाहर स्पेंड करने से वो जरूर हो सकता है.
Hanji. So in my experience, when I used to study, never studied for more than 6 hours a day. So at least 1 or 2 hours we actually have when we can be out in the balcony at least, or
हम्म.
go out for a jog or do some physical activity to improve the blood circulation to all parts of the body. You will be more alert for the next class, for the next day of study. It will also relax the mind to some extent. We
हम्म.
cannot be studying and then take a break and we open Facebook and our mind is going in that as well. तो
हम्म.
ब्रेन को भी थोड़ा रेस्ट मिल जाता है इस बहाने, आईज को भी रेस्ट मिलता है, पावर नहीं बनती है, पावर नहीं बढ़ती है अगर पावर है, and
हम्म.
the body also gets the circulation going through it, the muscles also stay healthy.
हम्म.
I would
ये
suggest that that should be followed.
आपने मेंशन किया था कि आयुर्वेद में कुछ there are some remedies which are suggested for better eye health. They claim to even reverse myopia. There is one question coming in from Stuti Parashar. She's asking, sir, could you please tell me how does walking on grass help? One other thing, people, there is a recommendation for improve eye health कि आप नंगे पैर घास पे चलें तो बहुत रिलैक्सेशन मिलती है और आईज को भी बेनिफिट मिलता है. इसमें कुछ सच्चाई है?
So once again, there's no harm in it, but there is no study which has proven it to work. नंगे पाँव सर्दी मतलब ओस होती है घास पे, उस पे चलना चाहिए सुबह. So there's no harm in it. If you're going outdoors, it is only good for you. But specifically for the eye, if it helps or not, once again, we do not have any scientific literature to prove that. Maybe वो acupressure का कुछ effect हो, वो भी scientifically proven नहीं है. So there's no harm in doing all of these things if they give you some kind of mental relaxation and you have a feeling of well-being after do them. By all means, do them. Going outdoors is always healthy, but there's no proof that these actually have very specific effects on the eye.
अच्छा. डॉक्टर सॉरी, मुझे आपसे पूछना था, जब वो आई रोटेशन वाली एक्सरसाइज मैं भी ट्राई करती हूँ, थोड़ा ऊपर देखते थोड़ा सा ऐसे यहाँ पर ना थोड़ा सा स्ट्रेन आ रहा है हेड पे, और हमें कुछ सवाल भी आए हैं कि वरद इज आस्किंग, eyes are getting pain when we move, what is the problem? Omi is also saying, sir, during the rotation exercise that you had mentioned, there was a strain while looking up. There's something wrong, what to do?
Yeah, so that is why we need to do the exercises. If our muscles are very strong and healthy, then any movement will not cause a discomfort. But if our muscles have some kind of a weakness, then doing the exercises will cause initial discomfort. And as our eyes, as the circulation to the muscles improves and our functionality of the muscles improves, that pain will disappear. So the pain is, in fact, more proof that you require to do those exercises. It's not just the up and down, even the obliques often require some stretching. So these exercises provide that stretch to the muscles, improves the circulation. And strain अगर हो रहा है तो फिर आपको डेली करना चाहिए अनीशा जी ये एक्सरसाइज
तो
पाँच
मतलब कि
मिनट के लिए.
आप ये कह रहे हो कि हमारी आईज के पास जो भी मसल्स है बहुत ही ज्यादा लेजी हो गई है, बिल्कुल भी वर्कआउट नहीं हुआ है, इसलिए स्ट्रेन हो रहा है. अगर रोज हम एक्सरसाइज करेंगे तो ऐसा दर्द नहीं होगा.
हाँ जी. तो
ओके.
आपकी मसल्स थोड़ा और थोड़ी उनकी हेल्थ बढ़ जाएगी, ब्लड सर्कुलेशन बढ़ेगा, एंड दैट पेन विल आल्सो स्टॉप.
ठीक है. एक और सवाल आया है भवी भवी बैनर्जी का. She's asking, sir, I don't have a computer or a laptop. How can I manage to have the perfect angle with a mobile phone so that the eye strain is reduced?
So this is a very common thing. A lot of
Mhm.
my patients also say that they have online school for which they use mobile phones.
Mm.
So the first question I ask is, do you have a stand for the mobile which you put on a table and keep your hands free to read and write? They say no. We hold it
Mm.
on our hand and we look
Mm.
down into it. So if
Mm.
you have a mobile phone, a very simple solution is to buy a stand for it. I think 50 rupees के अंदर वो stand आ जाता है. It's pretty good stand. उसको फिर आप टेबल और चेयर पे रख के imagine that is your laptop. Keep it at a distance from yourself and use your hands to read and write. You can write some notes to everything. Keep your hands free. In the process, आपका posture ठीक होगा, आपका distance increase हो जाएगा eyes से.
Mm.
So you will have to use it like a laptop. So do invest that 50 rupees in getting a stand for the mobile phone today itself. And from
Okay.
tomorrow, sit on a table and chair and use the stand to improve your posture and reduce digital eye strain.
Right. Dr. Chaudhary, एक सवाल आदित्य वर्मा का आया है. He's asking, is there any way to correct our vision without surgery? अब LASIK एक लेजर से ट्रीटमेंट होता है जिनको नेगेटिव आई नंबर होता है इसका वो करेक्ट हो जाता है पर बिना किसी सर्जिकल इंटरवेंशन के क्या विजन करेक्ट हो सकती है?
So, like I was saying, in young age, allopathy में कुछ उनका claim है, but allopathically, we have never seen any method through which we can reduce the eye without doing a LASIK or a smile surgery.
Hmm.
The LASIK and smile surgery is done only in people who are more than 18 years of age, that
Hmm.
is compulsory, and the power should have stabilized. If these two things are there, we can do a LASIK and remove the glasses altogether.
Hmm.
But there is no non-surgical way of removing the power
Hmm.
uh, of glasses. Another thing I would like to say is that if we stay uh, in this age when most of the students are in front of the computer a lot,
Hmm.
the emphasis should be on stabilizing the power. If the power is increasing very fast, do
Hmm.
the measures I was saying, spend outdoors time, reduce
Photos.
your screen time. But additionally, there are some other drops and other measures which are there to reduce the rate of progression of the myopia.
Okay.
So those drops your ophthalmologist will specifically give to you if it is increasing it at a
Very fast.
very fast rate.
Okay. Chris Chaudhary is asking, does dark theme in mobile or devices help in preventing the digital eye strain? और Indian gamer का सवाल है, does studying at night affect our eyes?
Yes. So both of these have a similar kind of a theme that
Hmm.
should we study at night and should we have a black backdrop. So you should have ambient lighting which is good, whether it is day or night. The
Hmm.
ambient lighting in the room should be good when you're looking at a screen. The wall or the things behind your screen should be bright, equally bright to your screen. Then whether it is day or night, it is okay. You can study even late in the night, you can study till 1 2 whatever suits you, but not in a dark room with a bright screen in front of you.
Mhm.
Similarly, if you have a black screen and you have the whole room dark, the strain and the glare will still be there. It will cause a lot of strain in the eyes, and over time, you'll start having tiredness of the eyes and other symptoms of digital eye strain. So, whatever device you're using, use it in a well lit room rather than a dark room.
Okay. Um, Ariman Shukla is asking, sometimes my eyes fill up with water and the teardrops start coming because of eye strain. What should I do? Uh, do eyes also get watery because of strain?
Yes, so Anisha, this is very interesting that
Mm.
once our eyes get dry, a
Mm.
very small scratches form in the surface of the cornea of the eye when we blink because of lack of lubrication. And those scratches then cause the eye to start reflex watering.
Mhm.
So watering can be a symptom of uh, a dry eye, and it can also be a symptom of extreme spasm of the muscles of the eye due to continuous usage of a screen without taking any breaks.
हम्म तो
So
ब्रेक्स आर वेरी इम्पोर्टेंट मतलब
breaks are
अगर
very
आपको इतने ज़्यादा टाइम पर आपको स्क्रीन के सामने रहना है तो अलार्म लगा लो और हर 20 मिनट छोटा सा ब्रेक ले लो
हाँ जी। और इनके केस में अगर वाटरिंग हो रहा है तो वो
हम्म
लुब्रिकेंट आई ड्रॉप भी शुरू करें साथ में. You
अच्छा
should do
दैट विल हेल्प
palming. That will help because the lubrication will be improved, the scratches will reduce, and the tearing will come down. Palming will also do good, like what you are also sharing, warm compresses. So that warmth and the pressure on the hands, that will also do good in reducing the watering. It is a very
राइट
useful thing to do palming.
ओके Ramya is asking, I usually see objects double. What
Hmm.
should I do? Yeah, I mean, is this related to screen time or is it another different eye condition? What's Ramya going through?
So Rania is probably seeing double after
Mm,
looking at the screen for some time. That is because the muscles of the eye need to converge when we are looking at a screen.
mm,
So that convergence weakness causes this doubling of vision.
mm.
So the first thing she should do is start the pencil push-up exercises. It's very
Okay.
simple. We have
Mm,
gone through it. So, just take a pen, look at the tip, bring it close to yourself. You'll see the background
mm,
becoming double, but the tip should become stable. And
mm,
even if the tip is blurred, it's fine. It should be single.
mhm,
Hold it there for 20 seconds and slowly, slowly take it away.
mm,
Keep looking at the tip and then do this again for 5 minutes. Repeat this test and this exercise. So, initially, when you start doing this exercise, you may feel the strain is more.
mm,
If you persist with it for 1 or 2 weeks, then that doubling will come down drastically.
mhm,
Doubling can also be due to dryness of the eyes. Doubling can also be due to excess spasm of the eyes. So
mm.
she should also follow the other things that we have discussed, but particularly she should be very diligent and regular with her convergence push-ups, pencil push-up
mm.
exercise.
ठीक है हेमंत शाह जी ने एक सवाल पूछा है कहती है उनकी बेटी 13 साल की है कैन वी यूज lubricant eye drops for a 13-year-old child
Lubricant 13-year-olds may, we can use lubricant eye drops for any age. They're preservative free, they're harmless. Even if you put them twice, thrice a day for 20 years, they won't cause
Mm,
any harm.
mhm,
Children generally do not have a deficiency in tear production. If they're
mhm.
having symptoms, it is because of excessive screen
Screen
usage
time.
or
Mm,
sometimes some allergies. So
okay.
it is a good idea to do cold compresses for such children who are having
Mm,
the strain and limit the screen time. The non-essential screen time है उसको आपको कम करना है. Easier said than done. You will have to involve yourself much more than instruct
right.
the child to do. Leave
Mm.
the phone, leave the TV. So
हमको खुद कम
engage
करना
him.
पड़ेगा जिससे पहले हम
हाँ,
बच्चों को बोलें
उनके
कि
साथ आप थोड़ा बाहर जाए so
हम्म,
automatically they'll happily go that they have some more time to spend with you. They will happily
हम्म,
go. Reduce the screen time by all means and make the screen further from the child. If you're giving him a mobile phone, switch it to the TV. You can
हम्म.
nowadays you can cast everything to the TV या TV पे ही आपका YouTube चल जाएगा या something.
तो अगर आप ये कह रहे हैं कि टीवी स्क्रीन देखना से इतना स्ट्रेन नहीं होता इज दैट ट्रू इज दैट व्हाट यू सेइंग
Yes, yes. The further the device is from the eyes, the
हम्म
lesser impact it has on the eyes. So a
ओके
TV is much better than
हम्म
a laptop, and a mobile phone is even worse than a laptop.
हम्म
The closer the screen comes to you, the worse it is for the eyes, the more strain it causes, and
राइट
also the more of power it induces.
हम्म एक और सवाल आया है रीना जैन का इज आस्किंग इज LASIK सर्जरी सेफ फॉर रिमूविंग ग्लासेस कैन वी स्पेंड मोर स्क्रीन टाइम आफ्टर दैट एंड शी सेइंग first get your eyes fixed and then is this a panacea for then just sitting for longer in front of a screen
Yeah, so we like to find a way of getting what we want.
A
So
way out, an easy
a
way
way
out.
out, anything to increase our screen time. So LASIK surgery is a process which has been there for more than 25 years now. So we have a
Mm,
very deep understanding of how it works and for whom it is safe, for whom it is
mm,
not safe. You can say for 9 out of 10 people it is safe. For
mm,
1 out of 10 people, it may not be safe.
mm,
So if you want to get a LASIK done, we first have to do some scans of the eyes. We have to check if your eyes tears production is enough, if your retina is fine, and
mm,
if all of these things are fine, then LASIK will be 100% safe for you. But
mhm,
1 out of 10 people, we tell them not to go for the LASIK, and if they
mm,
do go for it, despite our advice, then there is a chance that it can cause some harmful effects in future.
mm.
After
If
undergoing LASIK,
mm,
uh, you don't get a free license to use the screen.
mm,
LASIK is a means of getting rid of your glasses. You will be able to see without your
mm,
glasses what you are seeing with the glasses,
mm,
but the eyes stay the same. The
mm,
strain that the eyes have to do to focus for the computer stays the
it's the
same.
same. Mm,
So you will have to maintain all the same, uh, limitations and moderation in the screen usage
mm,
as
mhm.
before. And
Right.
LASIK will not give
डॉक्टर
you the
चौधरी,
license. Yeah.
लासिक का कोई विंडो ऑफ अपॉर्चुनिटी भी होता है? आपने कहा कि 18 साल के बाद ही करते हैं, पर क्या ये ओल्डर लोगों को रेकमेंडेड है? क्योंकि कई जगह मैंने सुना है कि 40-50 साल के बाद लासिक कराने का कोई फायदा ही नहीं है. इज देयर रियली अ विंडो ऑफ अपॉर्चुनिटी ऑफ गेटिंग दिस डन?
So LASIK is a procedure in which we remove the power of the eye by changing the shape of the
शेप
cornea
ऑफ द कॉर्निया,
to
या.
laser. And LASIK can be done at any age. In fact, in rare conditions, we have to do it in small children who have severe lazy eye, which is not improving with patching. We have done it even in 5-year-olds, and they have subsequently started improvement in vision if they have a lot of difference in power. We have done it in 80-year-olds who
अच्छा.
have a very high cylindrical power of glasses in one eye and the other eye is not there. They're having so much strain. They've had a cataract surgery, in fact. So
अच्छा.
we can do it even in 80-year-olds who require it for certain conditions. But
राइट.
if we want to see that LASIK we are doing for cosmetic purposes to get rid of glasses, then by and large 18 plus may we start doing it. After
ओके.
the age of 40, we require a power for reading as well. So let
एंड
us
ऑफ
say
द
there's
कॉइन.
someone, yeah,
हाँ, चश्मा तो आ ही गया फिर.
yes. So if someone is 45 years old, उसका दूर का भी चश्मा है, पास का भी चश्मा है. So the one thing which classic can easily do is दूर का चश्मा हटा देंगे, जब पढ़ना हो तब आप लगा देना.
ठीक है.
And now we have certain technology जिससे दूर पास दोनों का भी हम चश्मा उतार सकते हैं. We call this presbyopic classic.
ओके.
That up to the age of 50 we can do. But कई
राइट.
बार 50 क्रॉस करता है, then you have cataracts in your eyes, better not to go for LASIK. Cataract surgery should be a better option.
Right. Dr. Chaudhary, we'll take one last question. Siddharth Bajpai is asking, uh, does one feel sleepy because of eye strain? Does it increase laziness? क्योंकि
Yes,
बच्चे पढ़ाई करते हैं तो उनको लगता है कि बहुत देर मतलब स्क्रीन को देखते हैं कि थक जाते हैं, और फिर वो उनका मतलब ब्रेन भी स्पेस आउट हो जाता है, उनको कॉन्सेंट्रेट नहीं कर पाते. क्या इसमें सच्चाई है?
absolutely. If your eyes are tired, why will they want to stay open more and get themselves even more tired? So, uh, like if you want to, shoot an arrow far, you have to pull it back further. Like that, if you want to read more, you have to give your eyes breaks more. You have to give it more relaxation in between. And if your eyes are tired, you will feel like just closing your eyes and giving them the rest they require. Now, instead of reaching that stage when you are so totally tired, then it takes some days to come out of it. It is better to take mini breaks every day, every hour, and prevent such a situation from arising where your eyes are so tired that they don't feel like opening.
Right. So better to take regular breaks than to be completely exhausted and your eyes completely exhausted by just staring continuously into a screen. Thank you so much, Dr. Chaudhary, for joining us on this webinar today. I know it's been very informative for all those who are worried about how to tackle eye strain. Dr. Chaudhary has given very helpful tips. Please follow these. Put your alarm clocks. Put in your reminders. But do these exercises. Do take your breaks to give your eyes a rest, because one way or the other, screen time is increasing, but we have to take care of our own cells and our eyes. Thank you so much, Dr. Chaudhary, for joining
Thank
us
you,
today,
Anisha.
for
And
talking to us about eye strain and answering all the questions that you have. Thank you.
thank you so much for having me here. It was a real pleasure being with all of you, and for all the aspiring doctors, not aspiring, I would say future doctors and engineers, I would like to say all the very best. Spend this next few years till your exams studying, but do not take any stress for it. Enjoy your studies. Do not take tension. Nowadays, tension itni ho jati hai ki mind jam ho jata hai. Instead of that, have some physical activity, do some exercise as well, and in a balanced way, keep studying regularly. Akash is a very good platform which you are there. The discipline which it inculcated in me is probably one of the reasons why I could get through at AIIMS.
Mm.
So I'm sure all of you are on the right path, and I wish you all the very best in this endeavor. Thank you
Thank
so
you so
much, Anisha
much.
ji.
Thank you, Dr. Chaudhary, and all the very best to all the students studying very hard. Thank you so much for joining us.